Hi, I'm Dr. Lissa Rankin, and I'm the co-author with Jeffrey Rediger, a Harvard psychiatrist, of the book RelationSick, which will be out in May of 2026. And I want to talk today about whether your medical problem could be a marital problem. Or maybe you're not married, but it's another relational issue that could be at the root cause of your medical problem. I'll start. The reason I'm asking this question is because I used to practice as an integrative medicine doctor in posh Marin County, California. For those of you who know Marin County, you know it's like full of health nuts. These folks are as health conscious, health obsessed as any I've ever met. And so when I took this job, my patients were coming in with medical files this fat, with 10 diagnoses of difficult to treat conditions, things like chronic Lyme disease, fibromyalgia, a variety of autoimmune disorders, gastrointestinal problems like irritable bowel syndrome, chronic pain syndromes, hormonal issues, lots of things like that. Anyway, they had seen the best doctors at UCSF and Stanford. They had also seen their naturopath. They had gone to their acupuncturist. They were working out at their gym with their personal trainer. They were taking dozens of supplements every day. They were eating their raw vegan diet or their paleo diet, and really healthy in their intake of nutrition, caring about high quality nutrition, and really, as I said, kind of health obsessed. And yet, and these were often very young people. These were people in their 20s, their 30s, their 40s, and nothing was working, and they were getting worse over time. And I didn't really know what to do. I mean, I'm trained as a OBGYN doctor. I was working exclusively with women. Many of them had gynecologic issues and chronic pelvic pain and a variety of, medical issues related to gynecology, but also other general medical issues. And I would look through their file to try to see if their doctor had maybe missed anything, and they had often gotten extremely good medical care, but they weren't getting better. And so I created a different kind of intake form. It was about 10 pages long, and it was really an extremely comprehensive trauma screen. And I was asking them questions about their work, about their marriage, their relationships, their family history, not just their medical family history, but what it was like growing up in childhood, what their struggles were. I did an adverse childhood experience screen, and also screened for things like developmental trauma. I was screening for current traumas in their present life. And what I found over and over again was that I would ask questions like, what does your body need in order to heal? Or what is it going to take for you to live a life that your body will love? Or is there something missing from your life that I need to know about in order to help you get better? And they would almost every single one would start to cry. And over again. They knew intuitively what was dysregulating their nervous system, disabling their immune system, turning off the body's natural self-healing mechanisms, and putting them at risk for disease, making it difficult for the body's natural self-repair mechanisms to kick in. And they would say things like, I need to leave my marriage. I need to get into couples therapy and require that my partner respect my boundaries. I'm in a narcissistic abuse situation, and I know that my body is breaking down because I don't know how to handle being controlled and dominated and having my partner blame me for everything that they're doing that's hurtful. And they'd say things like, I've gotta, even though my narcissistic mother is sick, I've got to put her in a nursing home, or I've got to find somebody else that takes care of her. I can't be caregiving the person who abused me the most. Or I'm being absolutely exploited in my job, and I've got to stand up to my boss or quit my job or find a different way of showing up at work. And over I watched these people, when faced with the truth, when they finally said it out loud, then another part of them would come in and say, but I can't do that. But that's not possible. And they would contradict themselves. But the truth had been spoken, and they knew it. And I knew it. And I was a witness. And we were sitting there witnessing the truth together. And a percentage of those people never came back to see me again. They didn't want to talk about it. They were looking for the next doctor who would give them the next supplement. I doled out almost no medicines. I gave out almost no supplements. I did almost no specialty lab testing. I didn't charge my patients more than for my time, because really what they needed was a wake-up call about the link between their relational trauma and their boundaries and their bodies. And once the elephant in the room was named and spoken for, and the tears were flowing, then we could actually begin to do something about it. And so I created a whole protocol I'll be teaching about in the book RelationSick, but I'm going to be giving you some preview tips here on this YouTube channel. So please subscribe to this channel and share it with anybody that you know who you think might have a medical problem that's actually a marital problem or some other kind of relational problem, especially if you think it's related to narcissism or some form of unbalanced relationship where one person is giving to death, where they're giving to the point of depletion, where they're giving to the point of illness. And maybe they're just caregiving a disabled person and the other person is a perfectly lovely human being and it's not their fault, but they're a burned out caregiver. That's what we call a level 1 relationship in RelationSick. Or maybe it's your kind of classic grandiose narcissist with the codependent enabler, and the codependent one is the one getting sick. Or maybe that's what we call level 2. Level 3 is when you're in a coercive control situation where you are being dominated and it is making you sick. And coercive control is illegal in some places like the United Kingdom and Connecticut. And it's not illegal in other places, but I think it should be. So that's level 3. And level 4 is with somebody who is in a coercive control dynamic. So like a level 3 relationship where there's also other criminal behaviors going on. Maybe domestic violence, maybe sexual assault, maybe they're stealing your money. They're a con artist taking your property, things like that. So, we're writing RelationSick really for like the level 2 relationship, because that is potentially, there are things that you can do to change how you show up. And what I found with my integrative medicine patients and what my writing partner, Dr. Jeffrey Rediger, found in his 20 years of research on people with radical remissions, which he wrote about in his book, Cured. I did the same kind of research and I wrote about it in my books, Mind Over Medicine and Sacred Medicine. And when we joined forces, we both met at a trauma conference in 2019 that we were both keynoting at. And when we were kind of doing the brain dump on like, here's what I got, what have you got? What we found out over and over is that these people who are cured from quote unquote incurable diseases, frequently when we asked them, what do you think did it? Like, sure, they had changed their diet. Sure, they started a yoga program. Sure, they moved out of a toxic living environment and they moved to a beautiful retreat center in nature or things like that. But over and over what they said is, I was being oppressed. I was in a cult. I was in a narcissistic marriage. I was still under the thumb of my parents. I was in a system of oppression. I was BIPOC in America, or I was in the lowest caste system in India. I was in a cult being oppressed by the cult leader. And I did something to change that. And of course, it's not so easy to change systems of oppression, but we do have some control over the environments that we stay in, especially relationally. And so these were people who had gotten out of their toxic marriage. They had gotten out of their relationship with their toxic boss. They had gotten out of the cult, and they noticed within 3 months their symptoms were significantly improved, and over time their symptoms were sometimes disappearing even without conventional medical treatment. And now neither Dr. Rediger nor I recommend not following doctor's orders. Neither of us are promoting that message. But if you are following doctor's orders and it's not enough and it's not working and you're still sick and you're not getting better, especially if it's one of those difficult to treat conditions that often show up at an integrative medicine practice after failing all kinds of other medical treatments, we've got to ask the question, could this medical problem be a relational problem? So if you're interested in this topic, please subscribe to my YouTube channel. Please share this with anybody else that you think might benefit from this. And consider joining us for Love School, which you can find at lissarankin.com. It's a relational recovery program for people with or without chronic medical illness who are interested in relational recovery, who are maybe in narcissistic relationships or in unbalanced relationships, or maybe they're the more narcissistic one and they're looking to improve their relationships so that somebody else can get better physically. They're all welcome, and we're all practicing internal family systems, so it's hopefully a non-shaming, non-judging, non-demonizing way to talk about some of these issues in a trauma-informed and sensitive way. So thank you so much. Please let me know what you think in the comments, and thanks for being here with me.